All right, welcome everyone to the AI Research Roundup. I'm your host, Alex. Today, we're diving into a fascinating article by Google Research titled Benchmarking LLMs for Global Health, published April 30th, 2025. This post explores how large language models can be used to diagnose tropical and infectious diseases, affecting a staggering 1.7 billion people globally. They've created a massive data set of over 11,000 synthetic patient profiles, combining manual and LLM-generated data to benchmark the performance of these models in a real-world context, considering factors like location and cultural variations. So this figure showcases a sample persona from the dataset. Okay? It details a 28-year-old male with fever, severe headaches, fatigue, muscle and joint aches, a skin rash, and confusion. Importantly, it also includes location, Uyghur province, and the fact that he owns domestic animals. This illustrates how the dataset incorporates demographic, clinical, and contextual factors to better reflect real-world diagnostic challenges. So this figure illustrates how they built their TRINDs dataset. It's a layered approach. The base is the disease of interest, pulled from reliable sources. Building on that, they add the general and specific symptoms associated with each disease. The next layer incorporates the patient's location, specifically areas with high incidence of these diseases. This layered structure really emphasizes the importance of context, like we saw with the patient persona, in accurately diagnosing these complex tropical illnesses. Now, this figure really highlights the importance of context. It shows the diagnostic accuracy of the LLM under different combinations of information. Using the full patient persona, labeled FP, which includes everything, symptoms, location, risk factors, results in the highest accuracy. Well, clearly, providing more contextual information significantly improves the model's ability to make the correct diagnosis compared to just using symptoms alone, or even symptoms with just location or attributes. Okay, so this figure compares the Gemini LLM's performance against human experts on two question types: short answer questions, or SAQs, and multiple choice questions, or MCQs. We see Gemini achieves roughly 60% accuracy on SAQs and almost 90% on MCQs. Interestingly, Gemini outperforms the experts in most scenarios, except when any expert got the answer right, and, well, when all experts agreed. This reinforces the potential of LLMs while highlighting the complexity of these diagnoses, even for seasoned professionals. Now, this figure examines the LLM's performance across different race and gender subgroups. It shows the average accuracy across the original dataset, and then broken down by Asian, Black and white patients for race, and female, male, and non-binary for gender. Interestingly, there's no statistically significant difference in accuracy across these groups. This suggests that the model isn't biased towards any particular demographic, at least not based on these categories. So moving on, this figure presents a heat map showing the diagnostic accuracy for a range of diseases. It compares the LLM's performance using the full persona, a persona with just location information, and the performance of human experts. The color intensity represents the level of agreement, with darker blue indicating higher accuracy. It appears the model struggles with some diseases, even with complete information, while performing quite well on others, echoing the complexity we've seen previously. Finally, this figure shows how in-context learning, or tuning, improves the model's performance. We see the base model accuracy compared to the tuned model for both demographic and semantic augmentations of the data. Alright, so tuning clearly boosts performance in both clinical and consumer contexts, bringing accuracy closer to 90% in several cases. This suggests that targeted training can really help bridge the performance gap and improve diagnostic capabilities. To wrap things up, this figure showcases a user interface for a potential LLM-powered diagnostic tool. It allows input of patient demographics like age and sex, location, travel history, and various risk factors. So this really demonstrates how the research could translate into a practical application, allowing users to input relevant information and potentially receive a diagnosis based on the LLM's analysis. And finally, this figure shows expert feedback on the TRIND's tool's usability and trustworthiness. Okay, so experts rated the interface, the credibility of the analysis, and their understanding of the diagnostic reasoning highly, generally above 4 out of 5. This positive feedback reinforces the potential for real-world application, suggesting the tool is both user-friendly and provides trustworthy analysis. So building on all the findings discussed, this research from Google Research highlights the potential of LLMs in diagnosing tropical and infectious diseases, while also emphasizing the challenges posed by the complex and varied nature of these illnesses. Okay, a key takeaway is the importance of contextual information, like location and risk factors, in improving diagnostic accuracy. And the development of a user-friendly interface demonstrates the potential for translating this research into a practical tool. Thank you for joining me for this AI Research Roundup.